Hello ma'am, good morning or good afternoon. My name is Rajdeep Sharma and I am going to making a video about distribution of medicines. So here we have two distribution of medicine. There we have different and group or maybe different type. So there we have two type only mainly. So we can use outpatient or inpatient. Like the patient come to the doctor and doctor prescribe to the patient's drug what we have to he take or not. So doctor prescribe any medicines to the patients and patients take from the pharmacy, and the pharmacist also review all the prescription what doctor prescribed to the patients, and pharmacist also tell the patients that what medicines he take or what time he take the medicines. Like some medicines have to taking before and after meal, so pharmacist also mention all the medicines to the patients and tell what time and what medicine he or she will take the medicines. And the second method is about the inpatients, that is about the all patients come to the doctor and doctor admit the patients in the hospital, that then the nurse staff or doctor also go to the patients and also check the all the process the patients going good or not, all things disease going to good or not, that all checking the process. Then doctor or nurse staff go to the patient and prescribe the patient the last history of the patients and take the medicines or reduce or maybe increase the medicines to the patients. That are all them nurse staff or doctors directly give the patients, and that all the timely managed and give the patients medicines. There are two main type, that drug distribution to the medicine drug or medicine give to the patients. So that all the methods are we giving the patients, and there are maybe advantage and disadvantage. If the patients have all medicine take the patients home and maybe sometimes he forget or that all, then maybe some contraindications and some error in disease may be present or not, or if the patients are in it admitted to the hospital, then the doctor or maybe nurse staff take the all medicines give the patients, and that's all the all nurse staff and they monitor to the patients and give all medicines to the patient. So that's all about the process and all. Sometimes there are very disadvantage for the nurse staff, they individually for monitor to the patients and all. So sometimes we disappoint to the all, also disappear and all to the process and all. But mainly two type of distribution to the medicines, direct or indirect, directly by the nurse staff or doctors or indirectly by the pharmacist or doctor prescribe to the patients, and patients take by self or himself or herself by timing, that pharmacist also review to the patients. That's all about the video for distribution of medicines.